and salivary gland diseases. The malignant tumors, locally aggressive and grow along neural pathways, may access skull base and the brain, eventually adenoid cystic carcinoma. Also lymphatic and hematogenous spread. Our share in the mucoepidermoid carcinoma. Most common type of malignant salivary gland tumor, mostly affected parotid gland. It presents as a painless unless infection or invasion of vital structure. Metastasis is seen in high-grade tumors and have poor prognosis. The treatment is by surgical excision, and radiotherapy should be added to improve local control. Renal adenoid carcinoma is a rare type of cancer that can exist in many different body sites. It most often occurs in the area of the head and neck, in particular salivary gland. This tumor is generally well differentiated and slow growing. It's the second most common malignant salivary gland tumor overall. The treatment is the primary treatment by surgical removal with the clean margins, and radiotherapy is commonly given following surgery. Adrenal necrotizing cytometaplasia. It's a non-neoplastic inflammatory lesion of unknown etiology of minor salivary gland tissue, which both clinically and histologically mimics the salivary gland malignancy. Trauma leads to ischemia and acinar necrosis and squamous metaplasia of the duct. The lesion generally presents as an ulcer seen posterior in hard pellet. The investigation is by biopsy and treatment by irrigation by hydrogen peroxide or saline is self-limited and healing by secondary intention. The salivary gland dysfunction, osteoinasirostomia, a sensation of a dry mouth because of decrease of glandular secretion due to aging, duct obstruction, medications, radiation therapy, smoking, and Sjogren's syndrome. The treatment is by conservative treatment and maintain oral hygiene, use artificial saliva, and sialogogues. Nascialuria is excessive salivation. It may be mild or continuous drooling. This condition may be due to irritation from ill-fitting denture or heavy metal poisoning or mental retardation or medication. The treatment is by physical therapy and anticholinergic like atropine. The Sjogren's syndrome is a chronic autoimmune disease. It's a chronic autoimmune disease characterized by lymphocytic infiltration and acinar destruction of lacrimal and salivary glands, leading to dry eyes and dry mouth. In about half of the cases, the syndrome occurs in association with another autoimmune disease. Most frequently is rheumatoid arthritis and SLE. The syndrome is divided into primary and secondary Sjogren's syndrome. The primary Sjogren's syndrome is the combination of a dry mouth, xerostomia, and dry eyes, with zero ophthalmia. The secondary Sjogren's syndrome is the triad of xerostomia and zero ophthalmia and autoimmune connective tissue disease, like rheumatoid arthritis. And this is the symptoms, like dry eye and mouth, dental decay, oral yeast infection, and digestion issues, and joint pain and fatigue. The treatment is by medication, like decrease eye inflammation by eye drops such as cyclosporine, or increase the production of saliva such as bilocarbine, and this can increase the production of saliva and sometimes tears, or treat the system-wide symptoms like hydroxychloroquine. A drug designed to treat malaria is often helpful in treatment Sjogren's syndrome or by surgery, a minor procedure to seal the tear ducts that drain tears from the eye might help relieve the eye. Collagen or silicone plugs are inserted in the ducts to help preserve the eye. And surgical management. أول شيء عندنا superficial parodontictomy أو اللي هو شنو remove gland superficial to the plane of facial nerve. The treatment of choice for tumors in the superficial lobe which are not involving the facial nerve. عندنا adequate parodontictomy implies removing the tumor completely, taking care to avoid capsular rupture or nerve damage with approximately zero point 0.5 to 1 centimeter tumor-free margin. Require very careful and strict case selection. Should be done only in benign tumors. عندنا total conservative parodontictomy implies excision of entire parotid gland while preserving the facial nerve, done in a tumor involving deep lobe with intact facial nerve وبالhigh grade tumor with high risk of metastasis and positive margins after superficial parodontictomy. عندنا radical parodontictomy implies excision of structure other than facial nerve, done in cases of skin and infratemporal fossa and mandible and TMJ will better bone. عندنا complication of parotid surgery. أول شيء عندنا Cialoseals. Cialoseals may occur following surgery of the salivary gland and are also observed as a consequence of penetrative injuries of salivary gland. Cialosis is defined as accumulation of saliva either in the different ducts or after trauma or other injury to the glandular parenchyma. In such cases, often defined by inflammatory reactions such as pseudocyst, seroma shows a similar clinical picture but is characterized by a lower concentration of amylase. And we have Fry's syndrome. Fry's syndrome is a rare disorder that most often occurs as a result of surgery in the area near in parotid glands. The main symptoms of Fry's syndrome are undesirable swelling and flushing occurs on the cheek, temple, or behind the ear. The cheek will temple or behind the ears. After eating certain foods, especially those that produce a strong salivary response, symptoms are often mild and well tolerated. In some people, symptoms may be more severe and therapy may be necessary. The exact underlying mechanisms that cause Fry syndrome are not fully understood. Fry syndrome most often occurs as a complication of surgery to the area of the face near to the parotid gland. And thank you.